Hi, I'm Matt Damon.
Hi, I'm Hillary Clinton, and I'm here to talk to you about alcoholism. I'm going to tell you some stories about alcohol. So here goes the clips.
One summer night after drinking a few beers, Robert headed to a party in his dad's car. He says he'd had just enough beer to feel good.
It was one of those nights, you know, when you're on top of the world, nothing can happen to you, you don't care. I felt I was bulletproof. I felt I was unstoppable. I certainly wish that I hadn't have done it, but I need to accept that. I need to move on. I need to feel normal.
Why you don't drink and drive, kids. Once you drink, do not drive. Get somebody else to drive.
You're watching everybody else drink and you're just trying so hard not to drink. One day when I'm older and I'm successful and I have all the things that I feel as though I need and want, I just know that I'll look back and say, well, I stood my ground and I respected myself. I would tell other kids, you just gotta have that strength and just not to do what everybody else is doing just because everybody else is doing it.
Don't drink, kids. Don't drink. Just be yourself. Don't feed into peer pressure.
Alcohol was a way that I used to impress people. It changed progressively. I, wanted to drink more. And I didn't exactly know why.
Then one night, something horrible happened. Megan got drunk at a party, and a guy she'd never met before offered to help. Megan's parents knew something had happened. They wouldn't let it go. They confronted her. Megan was in so much pain that she finally told them everything and admitted that she needed help.
The next day, I was sent to a counselor. Basically, I was an alcoholic, is what she said.
Oh, that is so sad. Megan, you shouldn't have been drinking.
I don't drink alcohol and I don't need it because I feel like it's a magnet. Either you get into a fight, you're stabbed, shot, or arrested, anything can happen. You end up doing things that you don't like doing, or you end up regretting something that can affect your whole life.
It definitely can affect your life. It has affected mine in so many ways that I cannot mention right now, but just listen to me. I'm trying to tell you. Don't know what to do about these kids. Why can't you just listen? We try and tell you, but you don't listen, and bad things happen to you. We've tried to save you from this before, but you don't listen. Now you have bad memories. I just don't know what to do about these kids. I don't know. We warn them so much. They still don't listen. It's no hope. There's no hope for these kids.
Now on the American Health Journal. The Brookside Institute in Irvine, California is establishing itself as a pioneer in the treatment of drug and alcohol abuse, using an effective science-based medical program. Institute founder and executive director Keith Owens discusses an innovative treatment plan involving therapy, medications, and brainwave analysis.
Well, we started creating what we refer to as the Brookside Institute Recovery Protocol about 10 years ago. We started early on with some of the work from the University of Pennsylvania. We started with the work of Dr. Bopicelli and his work with naltrexone, which is an addiction medicine that was created and approved by the FDA, strictly for addiction. We also started using cognitive behavioral therapy, again, which was not new, but had shown to be the most effective therapeutic treatment out there for addiction and substance abuse. So after several years, we put together the original protocol starting with those two components. We started looking at some work that was done by Dr. Amen, who was doing SPECT scans. And in these SPECT scans, he was showing that there was a part of the brain that would overwork and some that would underwork. And so these dysfunctional aspects of the brain were contributing factors to addiction. So after studying the SPECT scans and some others, we also studied something called the reference EEG. And the reference EEG was a process of analyzing brain waves. And the brain wave analysis would actually show essentially some of the same things that the SPECT scan showed. What this was telling us was here was a dysfunctional part of the brain. Here was a part of the brain that was under or overperforming. So if we had a patient that came in with that kind of a dysfunctional brain, also substance abuse, we call that showing co-occurring disorders, we knew that before we could get him to respond appropriately to the addiction treatment, we needed to stabilize or normalize that brain. And so with the use of the REEG, we were able to identify the medications that would most appropriately work to bring those spikes into a normal space. In other words, we were trying to normalize. Once we normalized the brain, then we were able to work with the addiction issues with a far greater effectiveness. And so that became the Brookside protocol. That was the basis of looking at the patient. As we tell him, we want to pull back the curtain. We want to look to see what the issues are before we start treating.
Here at the Brookside Institute, one of the primary roles that I play is to diagnose co-occurring psychiatric disorders in the substance abuse population that we work with and to treat that appropriately. The whole point of Brookside Institute is for people to have a change in their lives. They obviously wouldn't even be here if they didn't feel like the alcoholism or drug abuse or psychiatric disorder did not impact their lives. And that's really the primary goal, whether they're having problems at work, problems with their family, problems with their friends, inability to socialize appropriately. Those are all the things that we truly are measuring as improved outcome. And so for me personally, I feel very good that we're improving people's lives through the Brookside Institute.
So the Brookside protocol is really one that is science-based, medical model, and will continue to work on cutting edge. There are a number of new medications in the pipeline now, which we'll be using. There are a number of new techniques, new diagnostic tools coming on, so we will pursue that alternative as opposed to a 12-step model.
Don't do drugs, kids. It messes up your brain. I'm trying to tell these kids, keep thinking of new ways to educate them about this, but it's not working. It's just not working.
I hope you'll think about what they've had to say. And be honest with yourself. Ask yourself a couple questions. Am I risking hurting somebody I love? Am I risking hurting myself?